Hello from KFF Health News and WAMU Public Radio in Washington, D.C. Welcome to What the Health. I'm Mary Agnes Carey, Managing Editor of KFF Health News, sitting in for your host, Julie Rovner. I'm joined by some of the best and smartest health reporters covering Washington. We're taping this week on Thursday, February 19th at 10 a.m. As always, news happens fast, and things might have changed by the time you hear this. So here we go. Today we're joined via video conference by Lauren Weber of The Washington Post.
Hello, hello.
Tami Luhby of CNN.
Glad to be here.
And Shefali Luthra of The 19th.
Hello.
Let's start today with the Food and Drug Administration. The FDA has now agreed to review Moderna's application for a new flu vaccine, reversing the agency's decision from just a week ago to reject the application because it said the company's research design was flawed. What happened?
I think we got to take a step back, and we got to think about this in the lens of the midterms, because, of course, we got to talk about the midterms on this podcast. But what we've seen really since the beginning of January, after Kennedy overhauled the vaccine schedule under Jim O'Neill, is a lot of changes. And part of that, I think, is due to a big poll that came out by a Republican pollster, the Fabrizio poll, that indicated that some of the vaccine changes were making voters nervous. Basically, it told the president and it told Republicans that maybe you shouldn't mess with the vaccine schedule as much. And ever since that poll has kind of reached the ether, you've seen a lot more tamping down of conversation about vaccines. So you've seen Kennedy stay a lot more on message about food. And then you saw what happened this past week with the Moderna flu reversal. So what ended up happening is the FDA came out and said they were not going to review the Moderna flu vaccine, which was an mRNA vaccine, which, as we all remember, was the vaccine technology that became quite famous during the COVID pandemic that Trump really championed in his first term. So the FDA came out and was like, you know what, we're not going to review this, which was a huge issue. It caused massive shockwaves through the vaccine industry. A lot of vaccine and pharma insiders said this could really dampen their ability to develop future vaccines because they felt like this action was made without enough explanation. And after a week of pretty much bad headlines and bad press, the decision was reversed. And Lauren Gardner from Politico had a great story along with a colleague where she pointed out that this reversal happened after a meeting with the FDA head in the White House, where Trump expressed some concern over the handling of vaccines. So I think this reversal that you're seeing fits into the broader picture of the unpopularity of Kennedy's push around vaccines. And I expect that, considering their hesitancy, along with a really contentious midterms race, we may see more pushback to whether or not Kennedy is able to continue on his push against vaccines.
So what are the implications for drug and vaccine manufacturers in the months ahead? How will this impact them? Does it provide stability and reassurance that if you spend billions of dollars on drug development, you're not going to be stopped by federal agencies?
I think the reversal maybe does, but I mean, certainly they're still spooked. I mean, the reality is that it's a little unclear. Obviously, there was a pressure campaign to reverse this, and it has been reversed. But the current makeup of the FDA with Vinay Prasad has led many to be unclear on what will and will not get approved. Under this HHS administration, there's been a big push for placebo-controlled trials and so on, and somewhat a shifting of expectations. And I think that while the reversal will settle feelings a bit, this is on a backdrop of hundreds of millions of dollars being canceled in mRNA vaccine contracts. So I think there's a lot of unease and there's a lot of fear that this could continue to damper vaccine development.
I think to add to what Lauren's saying, it's just pretty hard to imagine that after the past year and change that anything could really feel predictable. If you are in the business of developing biopharmaceuticals in any form, it's just so much has changed and so much really seems to depend on kind of the whims of where the politics are and where the different players are and who's carrying influence. It's just hard to really think about how you would want to invest, right, a lot of money in developing these products where you may or may not have success. But one other thing that I am just so struck by in this whole episode is there is a lot of tension in different parts of sort of the health policy community groups around how the FDA is approaching different policies. And one area I've been thinking about a lot is where the FDA has been on abortion is a source of real frustration for a lot of abortion opponents. And seeing this episode play out, if the White House did get involved, I think it raises a really interesting question for people who oppose abortion and want the FDA to take a harder look at it. Are they going to expect similar movement from the president, similar intervention or conversations from the White House? And if they don't get that, how does that affect, again, just another issue that feels really salient as we head into a midterm election that gets closer and closer?
And I think, this is a sign of what healthcare might mean and play in the fall election. So we'll keep our eye on that. Lauren, you just mentioned recently some changes at the Department of Health and Human Services. We're going to shift from the FDA to HHS, where there's been a shakeup in top leadership. Jim O'Neill, who had served as the HHS Deputy Secretary and as Acting Director for the Centers for Disease Control and Prevention, is leaving those positions. Other agency changes include Chris Klomp, who oversees Medicare, being named Chief Counselor at HHS, where he will oversee agency operations, and National Institutes of Health Director Dr. Jay Bhattacharya will also serve as Acting Director of the CDC. Clearly, there is a lot going on here. Why are these changes happening now?
So our understanding from reporting is that the White House wanted to shake things up before the midterms. I mean, if, kind of what I alluded to in my last comments is, Jim O'Neill was the person who signed off on the childhood vaccine schedule. I mean, his name was plastered all over that in January, and now he's been shipped off to be head of the National Science Foundation, but certainly not as high profile of an HHS deputy role or CDC acting director. From our understanding, that's because the White House wants a bit tighter control over messaging and overall thrust of HHS heading into the midterms. And I think it's notable, you mentioned Chris Klomp. I mean, let's note where he came from. He came from CMS. You're seeing a fair amount of folks from CMS, from Ausland, come into HHS and exert, seemingly, it looks like, more power based on the White House's judgment, along with Kennedy. Kennedy is said to have also signed off on these changes. But it remains to be seen, how this will impact HHS's focus going forward.
So while we're talking about HHS, let's look at Secretary Robert F. Kennedy Jr.'s first year in office. There's so much we could talk about. The firing of members of the Advisory Committee on Immunization Practices, also known as ACIP, and the addition of several members who oppose some vaccines. Major changes in the childhood vaccine schedule, changes that the American Academy of Pediatrics has called, quote, dangerous and unnecessary, close quote. Pullbacks of federal funding for vaccination programs at local departments that were later reversed by a federal judge. The firing of Senate-confirmed CDC Director Susan Maneras, who had only served in that position for less than a month. New dietary guidelines aimed at getting ultra-processed foods out of our diets, but adding red meat and whole milk, foods that many nutritionists have steered people away from. So this is an open question for the panel. What do you make of Kennedy's tenure so far?
I mean, he's certainly been changing the agency in ways that we somewhat expected and, other ways that we didn't. I will let the others speak to some of the, vaccine and others. But one thing that's also notable is the makeup of the agency. They've laid off or prompted many people to quit or retire. There's major staffing changes there as well. And there's a large brain drain, which has concerned a lot of people.
Yeah, I'll chime in and say, I think public health officials have been horrified by his first year in office. There is a growing fear that obviously his many vaccine changes could have long-term consequences for vaccine uptake and an increase in vaccine hesitancy. There's been a lot of concern among public health officials and experts that Congress really has not stepped in to stop any of this. That said, there are currently there's a lawsuit the AAP has brought against these changes, which could have an outcome in the coming days that may or may not impact whether or not they're going forward. You mentioned how he reconstituted ACIP, the Federal Advisory Committee on Vaccination. What's really interesting is right now we're unclear if that ACIP meeting is still happening at the end of February. And again, it gets back to my point of vaccines seem to be after this polling not where Republicans want to be talking. And so a lot of Kennedy's primary concern, even though he talked a lot about food in his first year in office, the Post did an analysis of his social media, and he talked way more about food than he talked about vaccines. But his focus and ultimately what he was able to upend a lot of was vaccine infrastructure. And I think this year we will see more of the impacts of that, and also whether or not he's allowed to make some of these changes. If there is enough backlash, or if there is enough pushback, or if there is enough political detriment that pushes back on what he has done.
And I think a really important thing for us to think about that Lauren just alluded to is a lot of the consequences of this first year are things we will be seeing play out for many years to come. There has been this dramatic upending of the vaccine infrastructure. We have seen medical groups try and step in and try and offer independent forms of authority and expertise to give people useful medical information. But that's a very big role to fill in the context of this tremendous brain drain. And I think what we are waiting to see is how does that translate to decision making on the individual level and on the aggregate level? Do people feel like they can trust the information they're given? Do they get the vaccines they would have gotten in the past for their families, for their children? Is it easier? Is it harder? Does those difficulties matter in the end? And that's the kind of impact and consequence that we can talk about now, but that we'll only really understand in years to come when we look at whether and how population health outcomes shift.
Sure. And so we're talking about, Lauren and the full panel has made this clear, talking about some of the shifts in the messaging out of HHS as we head into the fall elections. Lauren, if I heard you correctly, you were saying on Secretary Kennedy's social media feeds, he had talked a lot more about food than vaccines, but yet the vaccine message seems to have resonated more. So as you look towards the fall elections, right, we're talking about affordability. In a moment, we're going to be talking about the Affordable Care Act. We've read a lot, and folks have talked on this podcast about drug prices. Are the steps enough that are happening here on the messaging? Is it enough to focus the message, and is it going to land with voters? Or will they be looking at it in a different way?
And will he stay on message? I mean,
exactly.
I've watched hundreds of hours of Kennedy speaking, and the man, when let rip, I mean, recently he said in a podcast, he talked about snorting cocaine off a toilet seat. I mean, that was something that came up in a long form conversation. Obviously, there's more context around it, but he is known for kind of speaking off the cuff. And so, I think it remains to be seen if they are able to kind of see how that messaging in order to talk about drug prices, talk about affordability, if that continues to play for the midterms, and if it doesn't, what the consequences of that may be. I think it's important, too. I mean, last night, Trump issued an executive order that is aimed at encouraging the domestic production of glyphosate, which is a really widely used weed killer that has been key in a bunch of health lawsuits around Roundup and other pesticides. Is a real shot across the bow for the MAHA crowd. And it puts Kennedy in a tough position. I mean, he's issued a statement saying he supports the president. But I mean, this is a man who's advocated against glyphosate and pesticides for years and years and years. And it's really divided the MAHA movement that, many folks who said they joined MAHA, many MAHA moms, pesticides are a huge issue. And this could fracture this movement, that Republicans so want to keep in line for the midterms, just as they're starting to try to get on message.
One thing also that I wanted to talk about, my colleague Meg Terrell did a fantastic piece last week about Kennedy's first year, and it's headlined, "Trump promised RFK Jr. would restore faith in American healthcare. A year in, trust has plummeted." So I think that that's one thing that also we have to look at, is that Trump had said that there would be historic reforms to health and public health, and that, it would bring back people's trust and confidence in the American healthcare systems after COVID, and, after what he criticized, the Biden administration for. But also, it shows that actually, if you look at recent polling from KFF, it shows that trust in government health agencies has plummeted over the last year. So that's going to be something that they also have to contend with, both in the midterms and going forward.
Right. We'll keep our eye on those issues now and in the months ahead. And right now, we're taking a quick break. We'll be right back. All right, we're back and returning to the upcoming confirmation hearing for Dr. Casey Means. She's President Trump's nominee to be Surgeon General. The Senate Health, Education, Labor, and Pensions, or HELP Committee, as it is known, will consider that nomination next Wednesday, February 25th. You might remember that Means' confirmation hearing was scheduled for late October, but it was delayed when she went into labor. She was expected then to face tough questions about her medical credentials and her stance on vaccines, among other areas. Means is known as a wellness influencer, an entrepreneur, an author, and a critic of the current medical system, which she says is more focused on managing disease than addressing its root causes. If confirmed as Surgeon General, she would oversee the more than 6,000 members of the U.S. Public Health Service, which includes physicians, nurses, and scientists working at various federal agencies. What do you expect from the hearing, and what should people look for?
So I did a longer profile with my colleague Rachel Rubin on Casey Means last fall. And what we learned in really digging into, reading her book, going through her newsletters, going through her public comments is that, this is someone who left the medical establishment. She left her residency near the end of it and has really promoted and become central in MAHA world due to her book, Good Energy, which, some folks in politics have referred to as the Bible of MAHA. So if confirmed, I think she could play a rather large role in kind of shepherding the MAHA movement. But I think she'll face a lot of questions from folks about her medical license and practicing medicine. So Casey Means currently has a medical license in Oregon that she voluntarily placed in inactive status, which according to the Oregon State Medical Board means she cannot practice medicine in the state as of the beginning of 2024. Additionally, she has received over $500,000 in partnerships from various wellness products and diagnostic companies, some of which in her disclosure forms talked about elixirs and supplements and so on. And I expect that will get a lot of scrutiny from senators as well. And I will just note, too, I think it's important to look at a passage from her book that a lot of public health experts that we spoke to were a bit concerned about, because she wrote in her book that, quote, the ability to prevent and reverse, end quote, a variety of ailments, including infertility and Alzheimer's, is, quote, is under your control and simpler than you think. And statements like that really worried a fair amount of the public health experts I spoke to, who said she would have this bully pulpit to speak about health, but they're concerned that she doesn't underpin it with enough scientific reasoning. And so we'll see if those issues, and also obviously having to answer for Kennedy and the HHS shakeups and Kennedy and vaccines, I'm sure a lot of that will come up as well. I expect it to be a hearing with a fair amount of fireworks.
Do you think the fact that they've scheduled this hearing means that they have the votes for confirmation, or is it simply a sign that the administration just wants to get moving on this or shift a bit from some of the hotter issues that have happened recently?
This is a long time for the American public to not have a Surgeon General. So, I think they were hoping to get this moving to get her in the position. As I said, she could be a very strong voice for MAHA, considering her book underpins a lot of the MAHA movement. I think in general, Republicans do have the votes to confirm her, but it just depends on how much they are agitated by her medical credentials and some of her past comments. I think we could see some fireworks, but, we saw fireworks in the Kennedy hearing and he got approved. So, I think it remains to be seen what happens next week.
Sure. Well, thanks for that. Let's move on to the Affordable Care Act, or the ACA. More Americans than expected enrolled in ACA health plans for this year, even though the enhanced premium subsidies expired January 1st. But it's unclear if these folks are going to keep their coverage as their health care costs increase. Federal data released late last month showed a year-over-year drop of about 1.2 million enrollments across the federal and state marketplaces. But these aren't the final numbers, right?
No, what's going to happen is people have time now. They still have to pay their premiums. The numbers that were being released were the number of people who signed up for plans. So what experts expect is that over time, people who receive their bills may not pay them. A lot of people, remember, get automatically enrolled, so they may not be even aware of how much their premiums are going to increase until they actually get their bill. So they may not pay the bills, or they may try to pay the bills for a short time and find that they're just too high. Remember that the premiums, on average, premium payments were expected to increase by 114%, according to KFF. So that just may be unmanageable. The experts I've spoken to expect that we should get better numbers around April or so to see what the numbers of actual enrollees are, because people actually, if they don't pay their premiums, can stay in the plans for 3 months and then they get washed out. So we're expecting to see if hopefully CMS will release it, but we're hoping to see better numbers in April.
Shefali, I know you closely follow abortion. How much has the abortion and the Hyde Amendment played in all these discussions about Congress trying to find, if they really want to find, a resolution to this subsidy issue?
It's so interesting. A lot of anti-abortion activists have been quite firm. They say that there cannot be any permission that ACA subsidized plans cover abortion if the subsidies are renewed. That, of course, would go against laws in some states that require those plans to cover abortion using state funds, not using federal funds because of the Hyde Amendment. The president, relatively recently, even though it feels like a lifetime, said, we should be flexible on this abortion restriction that anti-abortion activists want. They were, of course, furious with him and said, we can't compromise on this. This is very important to our base. And they view it as the federal government making abortion more available. And so I think it's still an open question as to whether this will ultimately be a factor. It's, to your point, not really clear that lawmakers are anywhere close to coming to a deal on the subsidies. They very well may not, right? They still have to figure out funding for DHS. They have many other things that are keeping them quite occupied. But this is absolutely something that abortion opponents will remain very firm on. And I mean, they haven't had the victories they really would have hoped for in this administration so far. And I think it'd be very difficult for them to take another loss.
So, Lauren, what's going on with the discussions on Capitol Hill about potentially extending the enhanced ACA subsidies? We're hearing reports from negotiators that the deal might be dead. How would that impact voters in November?
I think people should be interested in getting a solution because I think talk about hitting voters' pocketbooks and actual consequences. I mean, this seems like this is a thing that's only going to continue to pick up speed. I was fascinated. I know you want to talk more about that great Politico piece that dives into the TikTok of how this all happened.
But yes, it's a great story.
I think in general, the ACA subsidies fall into a trap of most of the contentious two-party system that we're in right now, where, different issues that are issues that we can't touch end up blowing up problems that then affect everyday Americans in their day-to-day, and then no action gets made. And then we end up closer to the midterms where people actually may or may not want to do something. So I'm not sure that people don't want to do something. I'm just not sure that there's enough consensus around what that would be. And in the meantime, actual people are feeling the pain. So we'll see how that continues to play out.
Sure.
Oh, I was going to say, just to add one more point to what Lauren mentioned about political pressure and backlash, the latest polling from KFF shows that healthcare costs are voters' number one affordability concern. And we know there was that brief moment when the president said we should be the affordability party, not Zoran Mamdani and the Democrats. And so I think that's really interesting, right? Are they able to stick to that? Are they able to address this policy that voters are saying is such a high priority for them because it is so visceral, right? You know what you're paying and you know that your bills are higher than last year. And if they can't, is that the kind of thing that actually does shape how voters react in November, especially given so many other cost of living concerns many of them have?
Right. Well, one of my White House colleagues today wrote a great story about how the Trump administration's messaging, or what they're suggesting that the GOP message for the midterms is lower drug prices, which is something that they have been very active on. So they don't want to discuss the exchanges. And we'll talk a little bit about the new rule that they've just proposed. But yeah, I think the administration is going to focus on healthcare. They're aware of the concerns of healthcare, and their message is going to be, most favored nation, Trump RX, and the other efforts that they've made to lower drug prices, which is something, of course, Trump was also very focused on in his first term as well, but to less effect.
Speaking of that rule, Tami, can you tell us more about that?
Sure. Well, CMS wants to make sweeping changes for ACA plans for 2027. It issued a proposed rule last week that would give more consumers access to catastrophic policies. Now, these are policies that have very high deductibles and out-of-pocket costs, generally offer skimpier benefits, but importantly for the administration, have lower premiums. The proposed rule would also repeal a requirement that exchanges offer standardized plans, which are designed to make it easier for people to compare options. It would ease network adequacy rules and require, as we were just talking about, require more income verifications to get subsidies, and crack down on brokers and agents who we've just discussed about, have been some of whom have been complicit in fraud. The goal is to lower the ACA premiums and give people more choice, according to CMS. Premiums, of course, have been a big issue, as we discussed, about because of the increase in monthly payments due to the expiration of the subsidies. But notably, the agency itself says that up to 2 million people could lose ACA coverage because of this proposed rule. It's a sweeping 577-page rule, I think. And if you want to get more information, I highly recommend you read Georgetown's Katie Keith's extensive 3-part breakdown, which was published in Health Affairs.
All right. Well, we'll have to keep our eye on that rule and all the comments that I'm sure will come in.
Many comments.
Many. I'm also intrigued about some of the GOP talking points on potential fraud in the program. For example, the House Judiciary Committee has subpoenaed 8 health insurers asking for information on their subsidized ACA enrollees and potential subsidy-related fraud. It has been a Republican talking point that it's their perception from many Republicans that there is a lot of fraud in the program that needs to be investigated. Is there any merit to the claim, and will this discussion of fraud shift away from this really critical affordability issue that we're all talking about?
Well, we know that there has been fraud in the program, particularly after the enhanced subsidies went into effect. I mean, even the Biden administration released reports and information about brokers and agents that were basically switching people into different plans, switching them into low-cost plans, enrolling them in order to get the commissions. And that's one of actually played also into the argument on Capitol Hill about extending the subsidies, whereas the Republicans were very forceful about not having zero premium subsidies because they felt that this helped contribute to the fraud. So, that's not an issue anymore because the subsidies were not renewed. But both CMS and Congress are still focused on this idea of fraud with the subsidies.
All right. Well, we'll keep watching that now and in the months ahead. So that's the news for this week. And before we get to our extra credits, we need to correct the name of the winner of our Health Policy Valentine's contest. The winner is Andrew Carleen of Massachusetts, and thanks again to everyone who entered. All right, now it's time for our extra credit segment. That's where we each recognize a story that we read this week and think you should read too. Don't worry if you miss it. We'll post the links in our show notes. Lauren, why don't you start us off this week?
Yeah, I have 2 pieces. A piece from Neiman Lab, The Atlantic's Elizabeth Brunig on her hypothetical heavily reported measles essay. And then I also have one from my publication at the Washington Post. It's from Scott Nover. The Atlantic's essay about measles was gut-wrenching. Some readers feel deceived. And for a little bit of background for anyone who didn't read it, Elizabeth wrote a very striking, beautifully written piece in The Atlantic from the perspective of a mom who lost her child to measles after a fatal complication that can happen from measles. But the way it was written, a lot of people did not realize it was fiction, or creative nonfiction, or creative fiction to some degree. And so it was written from the perspective like it was Brunig's story. But at the very end of the piece, and it turns out this was attached later after publication, was an editor's note saying this piece is based on interviews. I gotta say, when I initially read it as a savvy consumer, I initially was like, is this her story? Until I got to the editor's note at the end. The Neiman Lab reporting says that editor's note wasn't actually even on the piece when it started. I think this is a fascinating question. In general, I think that in an era where vaccine misinformation is rampant and the truth is important, it seems like having a pretty clear editor's note at the top of this piece is essential, but that's just my 2 cents on that. And I thought both of the discussion and the online discussion about it was really fascinating this week.
That's fascinating indeed. Tami, what's your extra credit?
My extra credit is titled New York Presbyterian Nurses Reject Contract by Overwhelming Margin by Claudia Irizarry Aponte and Ben Frachtenberg in The City, an online publication covering New York. We've been having a major nurses strike in New York City. It's, notable in the size and number of hospitals and length of the strike, which has been going on already for over a month. It's affected several large hospitals, Mount Sinai, Montefiore, and New York Presbyterian, with nurses demanding stronger nurse-to-patient staffing ratios, which, has been a longstanding issue at many hospitals. Now, the interesting development is that the city uncovered a rift between New York Presbyterian's nurses union and their leadership. So what happened is the nurses at Montefiore and Mount Sinai have recently approved their contracts and are back to work, but the New York Presbyterian nurses did not approve their contract because the language differed on the staffing ratio enforcement and did not guarantee job security for existing nurses. And what actually apparently happened is that the union's executive committee rejected the contract, but the union leaders still forced a vote on it, which was actually end up voting down. So now the nurses have demanded a formal disciplinary investigation into the union leaders for forcing this vote. So more than 1,500 nurses at New York Presbyterian signed the petition, and more than 50 nurses delivered it to the New York State Nurses Association headquarters. One nurse told the city, "They are overriding our voices." The union president urged members not to rush to judgment. Now, the New York Presbyterian nurses remain on strike, which has lasted already for more than a month. And it's going to be interesting to watch how this develops, especially because you have, obviously, the contentious negotiations between the hospital and the nurses union. But now you also have this revolt and, issues within the nurses union itself.
Wow, that is also an amazing story. Shefali.
Sure. My piece is from NPR. It is by Jasmine Garst. The headline is "Minneapolis Doctors Warn of Lasting Medical Effects Even After ICE Agents Leave." And the story looks at something that we know from research happens, but on the ground in Minneapolis, of people concerned about ICE and immigration presence at medical centers delaying important healthcare. That can be treatment for chronic ailments. It can also be treatment for acute conditions. And what I like about this story is that it highlights that this is something that is going to have consequences even now with this surge of DHS law enforcement in Minnesota winding down. The consequences of missed healthcare can last for a very long time. And something I have heard often when just talking to immigrants and medical providers in the Minneapolis metropolitan area is exactly this fear that they actually don't know what the coming weeks and months are going to bring. They don't know when they will feel safe getting healthcare again, when it will feel as if the consequences of this really concentrated federal blitz will be ameliorated in any way. And I love that this story takes that longer view and highlights that we are going to be navigating the medical effects of something so seismic and frankly pretty unprecedented for quite some time. And I encourage people to read it.
Thank you for that. My extra credit is from Politico by Robert King and Simon Levian, called "Why Congress Failed to Reach an Obamacare Deal." The piece is an inside look at why and how Congress failed to take action on extending the Enhanced Affordable Care Act subsidies, which led to the longest government shutdown in U.S. history and higher ACA premiums for millions of Americans. Okay, that's this week's show. As always, thanks to our editor, Emery Heuerman, and our producer and engineer, Francis Yang. A reminder, What the Health is now available on WAMU platforms, the NPR app, and wherever you get your podcasts, as well as, of course, kffhealthnews.org. Also, as always, you can email us with your comments or questions. We're at whatthehealth@kff.org. Or you can find me on X at Mary Agnes Carey. Lauren, where can people find you these days?
On X and on Blue Sky at Lauren Weber HP. The HP stands for Health Policy.
All right. Shefali.
On Blue Sky at Shefali.
And Tami.
You can find me at CNN.com.
We'll be back in your feed next week. Until then, be healthy.